We would like to welcome you to the lecture on health services as a health determinant. We are very delighted to be giving this lecture, and this lecture has been prepared by myself, Dr. Flavia Senkubuge, together with Dr. Joyce Shirinde. When you are done with this lecture, we would like you to have knowledge of how to discuss the complex relationship between access to healthcare and the health of a population. Before we begin our lecture, I'd like to start off with an excerpt from Pizarro and Stevens in their paper titled Healthcare System and Addressing the Determinants of Health, and you can find it in the Journal of Integrated Medicine, and I've put the reference there. Pizarro and Stevenson say the US population is sick and becoming sicker at all ages. For the first time ever in history, children born today are projected to live shorter lives and suffer a heavier burden of disease than their parents. They continue and say, yet we spend much more per capita on health care than any other country. And they conclude by saying something is fundamentally wrong. This particular excerpt really frames what this lecture is all about. Why are people still getting sick, even in the face of us spending much more money on healthcare? What are these things that are fundamentally wrong? You may ask, what about Africa? If Stevenson and Pizarro indicate that even after expenditure, there are still poor health outcomes, what about Africa? Please take your time and write a short excerpt similar to what Pizarro has written about your thoughts on Africa and its health outcomes. Welcome back. I hope you enjoyed the exercise of looking at the excerpt that you would write about Africa and what is fundamentally wrong, even in the face of us spending enough on healthcare. Because the reality is, health is a product of a number of factors. Health is a product of macro factors, and it's also a product of micro factors. The macro factors are political factors and economic factors, while the micro factors are, first of all, central is health, but also environmental factors, medicines in healthcare, and psychosocial factors. So if you look at all of this, this particular slide really shows that health is not just only constituted by the individual well-being or the biological issues of a patient, but really there are a number of factors that will determine how healthy an individual is, and many of them are outside their individual realm. Political factors, economic factors, environmental factors, medicines and healthcare, and psychosocial factors. It is also noteworthy to discuss some of the key global health issues. Number one are the threats of infectious diseases. At the moment, during this time, COVID-19 is a reality as a global pandemic and certainly a threat of infectious diseases. Health insecurity is a key point on the global health agenda and is a key global health issue. Non-communicable diseases, which are diseases which cannot be transmitted from one person to another. These include diseases such as cancer, hypertension, and diabetes. Trade and health, economic and social development, disasters and conflicts, sustainable development, the international agreements, and of course, governance of health. Of importance is that the global health issues, when taken together, it is important to note that each and every single one of them will need their own approach in order to address them. But all in all, the idea is to show you that indeed the key global health issues don't only rest as part of just a tinier health narrative, but in fact span a wider range from the burden of disease, from trade to economics to leadership. And so therefore it is important to be well versed with these broad health issues as part of a broader understanding of what is going on in global health. Additionally, the global policy agenda talks of 17 goals, and these are called the Sustainable Development Goals. These 17 goals follow on what was previously known as the Millennium Development Goals. So once the Millennium Development Goals ended, then the global policy agenda was around attaining the 17 Sustainable Development Goals. And these goals really start from Goal 1, poverty, 0 hunger, all the way to Goal 17 on partnership for the health goals. Our concern usually in health is around Goal 3, which is good health and well-being. But as you can see, you cannot achieve Goal 3 on its own. You do need to address poverty. You do need to address hunger. You do need to address quality education. And so each and every single one of these goals is actually interlinked and also does affect the good health and well-being. And this is the global policy agenda. You may ask, what about Africa's agenda? Because we've just discussed that the global policy agenda is articulated as the Sustainable Development Goals. So what is Africa's policy agenda? Africa's policy agenda is articulated as Vision 2063, an integrated, prosperous, and peaceful Africa driven by its own citizens and representing a dynamic force in the international arena is the vision for Agenda 2063. And there are a number of pillars. The first one is around a prosperous Africa that really looks at inclusive growth and sustainable development. The second one is around integrating the continent politically, ensuring that there is unity. And the third one is around good governance, then peace and security, the strong cultural identity and development of people, and ensuring that Africa is strong, united, resilient, and influential global player and partner. You will see that this Africa policy agenda is rather broad, but again, if you consider what we discussed under the reality of health and well-being, that indeed health and well-being is a constellation of a number of factors, and many of these factors fall outside the health space. This is the cover page of the Agenda 2063, the African Policy Agenda titled The Africa That We Want. Please download it and keep it in part of your library and reference for you to refer to in future. Let's bring it home to South Africa. In South Africa, we have a health system that has been historically divided by race, and even today, the health system is still grappling with the injustices of the past. We have a two-tiered health system, a private sector and a public sector. The private sector serves 16% of the population, while the public sector serves 84% of the population. South Africa spends about 8.3% of GDP that's allocated to health. GDP stands for Gross Domestic Product. The WHO recommends that for high-income countries should spend 7% of the GDP on health. Middle-income countries 5.8% and low-income countries 4.7%. South Africa, though, still has poor outcomes, as evidenced by the quadruple burden of disease. In South Africa, the 8.3% of GDP that's allocated to health is allocated as follows. 4.1% goes to private And as I indicated, private serves only 16% of the population. The rest, 4.2%, goes to public, where public serves 84% of the population. There are issues around quality of healthcare, namely cleanliness, safety, and security of staff and patients. The issues of long waiting hours, the issues around staff attitudes, unkindness from staff, the issues around infection control, and the other challenges are around drug stockouts. South Africa has, as I said before, a quadruple burden of disease. And this quadruple burden of disease is constituted by communicable diseases such as HIV and AIDS and TB, non-communicable diseases such as cancer, mental health, hypertension, diabetes, maternal, infant, and child mortality, together with injury and violence. Some of the other key policy issues are shortage of human resources, also maldistribution. For instance, the public sector does not have enough human resource capacity as compared to the private sector, and also maldistribution between urban versus rural areas. So we have dealt with the key health policy and management issues. And so what are the plans? In South Africa, we have a number of plans that have been put in place to address the key health policy and management issues. For instance, primary healthcare. And with primary healthcare, there is a process of re-engineering primary healthcare and also introducing a number of new initiatives, for instance, community-oriented primary healthcare model. And this model was developed by Sydney and Emily Koch in the 1940s in Tugela Ferry. And with this model, primary healthcare is ensured in terms of being a whole approach. The next one is the negotiated service delivery agreement. And also, please go and have a look at the 10-point plan. The 10-point plan spells out the key points that the National Department of Health is going to focus on in order to address the key health policy and management issues. Then, universal health coverage is really a global mandate, and universal health coverage has got two legs. One, it's about the strengthening of the health system, and the other leg is around funding of the health system. In terms of funding, South Africa has articulated its funding model as the NHI. NHI stands for the National Health Insurance, and currently the NHI is being piloted in a number of provinces and in a number of districts in the country. The next one then is training of health managers, because one of the things that has been realized is that the issues around leadership and management really do directly affect the plans to meet the desires of the health system. Also, the introduction of the Office of Health Standard of Compliance is another one, in order to look at the health standards within the whole health system. And then lastly, the human resources strategy, which really starts to set out the human resource needs for the country. So the key question still remains, and that is, how does access to healthcare affect the overall health of a population? Please watch this video that discusses Africa's demographic transition, the planning for the future of Africa's youth. This video begins to answer the question about how does access to healthcare affect the overall health of a population, with a specific angle on Africa. As we discuss the various contributors of the social determinants of health, it is important to understand what access to health is. Access to health is defined as the timely use of personal health services to achieve the best possible outcomes of health. And so, in essence, access to healthcare is not just boxed in a tiny little corner, but really is very broad and talks about personal health services, but importantly, that these personal health services are there in order to achieve the best possible health outcomes. It is also important to understand how healthcare affects population health. In other words, how individual healthcare affects the health of an entire population. And so individual healthcare really reaches a small minority of the total population. And the people who will be reached then are those people who access the healthcare, and these will be people who are sick or people who are dying, and therefore these will be people who need healthcare. And so while the impact of individual healthcare intervention may be important and decisive for those people who require that care or treatment, the impact on the entire population is much less. And so, for instance, the impact on an entire population's life expectancy or even the impact on most people is really quite small. As I discussed previously, the individual healthcare of a patient marginally improves population health. And that is why we have public health. Public health is not for the benefit of just one individual or identifiable person's care or treatment, but it's for the good of the general public and the protection of vulnerable population. Public health then is population health, and it includes things like immunization programs, food inspection and supplementation, protecting potable water supplies, safe garbage, sewage disposal, and many, many other things that you can go and look up. There is no doubt that individual healthcare has become more effective, it's become safer, and certainly it's become more accessible. But still, it's a major determinant of population health because with individual healthcare, as discussed previously, it's only a small minority of people who receive it. And again, it's those people who are already sick or people who are seeking care, and not the entire population benefits from individual healthcare. Public health, on the other hand, is conceptually different from individual health because public health deals with populations while individual healthcare deals with individuals. Health research is a very important component of both public health and population health and healthcare. And so, in essence, health research provides the evidence both for individual healthcare and also for public health or population health. And so, research in all contributes massively to the understanding of the factors involved in disease. But it is important to know that research does have its unique limitations. And so, all in all, research is a key component of both individual healthcare and also public health because it does provide the evidence that we need for decision making. Healthcare research, though, is only focused entirely about disease management. On the other hand, population health or public health research is focused more broadly on human health or population health. And so there is a distinction between the research that is done for healthcare and the research that is done for population health. But as I said previously, all in all, research is a very key component of both population health or public health and also individual healthcare. Another key concept to understand is preventative medicine, which has got two pillars. The first one is early detection through screening, and the second one is early intervention to modify the risk of adverse outcomes. And so preventative medicine is important in terms of improving health. But while the potential for health improvement exists because of preventative medicine also entails overdiagnosis, overtreatment, and inappropriate intervention, and therefore can also, in fact, cause harm. On the other hand, if we look at the second pillar on early intervention to modify the risk of adverse outcomes, modifying a risk factor for disease is really not the same thing as changing a disease outcome, and it still remains important to ensure that a disease outcome is changed, even over and above modifying a risk factor. We discussed about how healthcare of an individual affects an entire population, and we discovered that indeed the healthcare of an individual really affects the population marginally. And that is why it is so important to have interventions for an entire population. And what about the healthcare system? There is no doubt that the quality of healthcare provided in developed countries has significantly improved, and it does continue to improve. But there are a few challenges, and the challenges are around scope, they are around access, and they are around effectiveness. And so in reality, most healthcare systems around the world really manage diseases. And so it is important to also develop the leg in the health system where it is not only just about management of disease, but to ensure health and wellness. And so therefore it means to prevent disease and also to maintain health. There are a number of aspects of the healthcare system. The first one is primary healthcare, and primary healthcare is the first point of contact and usually is the first point that provides care. It's usually provided by family physicians, it's provided in emergency rooms, and also in clinics. The second one is secondary care. Secondary care is the most common venue for routine treatment services such as obstetrics and gynecology and general surgery. Usually you'll find secondary care at a community hospital, or some countries even call them community health hospitals. Tertiary care is a little bit more complex, and this is specialized care. And you find it in a number of countries. For instance, in South Africa and Canada and many other countries, you will find, for instance, universities that are affiliated to tertiary healthcare institutions. And these university hospitals will be called teaching hospitals. For instance, at the University of Pretoria, our teaching hospital is called the Steve Biko Academic Hospital. And so the Steve Biko Academic Hospital as a teaching hospital is affiliated to the University of Pretoria. There are also cancer centers, psychiatric hospital, and also consultants who are medical specialists. All these constitute tertiary healthcare. Social care is also important, and it is the provision of care, particularly long-term care, for the frail, the elderly, those with chronic conditions, and people with severe disabilities. Social care is usually provided for in home care or even in nursing homes. The other component is informal care. Informal care is the provision of care and support by family members. Often it's a daughter, a sister, a spouse, or even an adult child. And most of this informal care is usually found when we deal with special needs children and adults, where it's provided for by families. And usually the family members who provide informal care are usually women, and therefore creating a gender disparity. Informal care has become particularly important, especially during the COVID-19 pandemic, where we see that because of the stress that is created by the COVID-19 pandemic on our health system, more and more households have had now to informally care for their sick. Healthcare is about a number of factors, and we will discuss them briefly. Health coverage, provider availability, provider linguistic and cultural competency, and quality of care. Universal health coverage means that all people have access to health services that they need, when and where they need them, without financial hardship. And universal health coverage includes the full range of essential health services, and these would be from health promotion to prevention, treatment, rehabilitation, and palliative care. Currently, we have at least half of the people in the world who do not receive the health services they need. About 100 million people are pushed into extreme poverty each year because of out-of-pocket spending on health, and there is no doubt that this indeed must change. And so to make health for all a reality, we need individuals and communities who have access to high-quality health services so that they can take care of not just only their own health, but the health of their family. We also need skilled health workers providing quality, people-centered care. And we also additionally need policymakers who are committed to investing in universal health coverage. There are a number of barriers for accessing healthcare. The one is inadequate health insurance. In many countries, health insurance is only accessible to a small minority within a population. It is exactly the same in South Africa. There are also financial barriers, be it for those with or without health insurance or medical aid. For instance, if you are accessing health and you have no medical aid, that therefore means you have to pay out of pocket. And sometimes if you have a medical aid, the medical aid can run out, and therefore that means you have to top up and again pay out of pocket. And so therefore you will incur a number of costs, and these particularly are, for instance, for dental care or eye care, rehabilitation, and social health services. The other barriers for accessing healthcare and also issues around equity include the limited availability of healthcare resources. For instance, shortage of staff, shortage of health equipment, medication, water, electricity, and so on. There is also the issue of geographic distribution of healthcare resources in many, many countries. And the distribution is uneven, where you will find that healthcare resources are more readily available in urban settings compared to rural settings. Accessibility and equity also require services that are appropriate for all populations in need of them. So, services available in the language that the patient will understand is important. Cultural safety, issues around equity of rural and urban population, as we discussed when we talked about geographic distribution, and also equity when it comes to migrants in your health system. It's now time for us to pause and reflect and ponder on a number of questions. And these questions are really around health as a public good. The first question is, Is healthcare a commodity? For instance, like going to the spa? Or is it a necessity? Like, for instance, an ambulance arriving at a serious car crash? What do you think? The second question, are market mechanisms, including users having to pay for services, appropriate? Or should services be either publicly provided or paid for from public funds, for instance, taxes? What do you think? The third question, are health and healthcare mostly personal responsibilities or public ones in which we should be supporting our fellow citizens? And this question speaks to social solidarity. What do you think? Welcome back from your pausing and reflecting on whether health is a public good. Now, in order to get your answers, please watch the following video, which deals with universal health coverage, the best investment for a safer, fairer, and healthier world. In conclusion, the social determinants of health are recognized as important indicators of health and well-being. While healthcare services that we discussed, that include primary, secondary, and tertiary care, have not until recently been considered as a social determinants of health, and one can see how important they are, and that's why now they are a big consideration of the social determinants of health. And inequities in access to healthcare are changing this view. These inequities include, for instance, the barriers that are faced by a number of population groups, especially in a number of areas, for instance, at point of care. Perhaps if you can look an example, for example, at cultural competence of healthcare providers, which is particularly an important consideration in our region. Social justice is a narrative that has become even more prominent in recent times, and the social justice perspective can really help health personnel to understand how to link inequities in access to poorer health outcomes, and they also call on health professionals to break the cycle of oppression that contributes to inequities, and not only just contributes to inequities, but also contributes to the persistence of inequities. Now, please reflect on what your contribution will be in order to ensure that health services are a contributor of the health determinants of health.